is a 36-year-old female, once got admitted in a hospital with complaints of acute onset of palpitation. On examination, her heart rate was 160 beats per minute. That means she has tachycardia. Tachycardia is defined as a heart rate of more than 100 beats per minute. First in the management of tachycardia is to determine whether the patient has pulse or not. If no pulse, treat as cardiac arrest. If pulses are present, determine whether the patient is stable or unstable. This patient is stable with normal BP and no signs of shock. So what to do with the stable patient with tachycardia with pulse and normal BP? So look at the ECG. Look whether it's a narrow complex or wide complex. If it is narrow, look whether it's a regular or irregular. First we will discuss about narrow complex regular tachycardia. It includes sinus tachycardia, SVT, atrial flutter, central tachycardia, etc. This is sinus tachycardia. Sinus tachycardia is always almost physiological. Causes include fever, pain, anemia, hypovolemia, etc. Treatment involves identification and correction of underlying problems. For other narrow complex regular tachycardia, consider carotid sinus massage, adenosine. If ineffective, use beta blockers, calcium channel blockers. So how to do carotid sinus massage? Massaging the carotid sinus stimulates an area in the artery wall that contains nerve endings. This nerve slows down the heart rate directly. Contraindication includes myocardial infarction, TAA, CVA. Relative contraindication includes presence of carotid bruit. Carotid bruit is an abnormal sound heard over the artery. It may reflect the turbulent blood flow. This could indicate carotid artery disease. It's important to realize that there is a small risk of stroke if there is a carotid plaque. It's important to check for carotid bruit before performing this procedure. Or can use ultrasound and look for stenosis or arthroma. First, patient positioning. Identify carotid sinus location at midpoint between angle of mandible and superior border of the thyroid cartilage. Start with carotid sinus on the right side. Massage gently. Do not apply so much pressure to occlude artery. By using a circular motion, rub and massage the carotid sinus for a period of 5 to 10 seconds. After performing the carotid sinus on the right side of the patient neck, repeat the massage on the patient left side. Adenosine. First dose 6 mg IV rapid push in 1 to 3 seconds, followed by normal saline flush, then elevates the extremities. Second dose of 12 mg IV if required can be given in 2 to 3 minutes. Contraindication in drug or poison-induced tachycardia. Reduce initial dose to 3 mg in patients receiving drugs like dipyridamole, carbamazepine or in cardiac transplant patient. Side effects include flushing, brief periods of bradycardia and asystole. Adenosine can cause bronchospasm, so better avoid in patients with asthma. Narrow complex irregular tachycardia like AF, multifocal atrial tachycardia, flutter with variable conduction, consider beta blockers or calcium channel blockers or rhythm controlling drugs after expert opinion. So once more, first look whether the patient has pulse or not, then look whether the patient is stable or unstable. If stable, look whether it is narrow or wide. If it is narrow, look whether it is regular or irregular. If regular narrow complex, treat with carotid sinus massage and adenosine. If ineffective, beta blockers, calcium channel blockers. If irregular, consider beta blockers, calcium channel blockers. Rhythm controlling drugs after expert opinion. In wide complex tachycardia, give adenosine only if it is regular and monomorphic. Otherwise, consider antiarrhythmic. Amiodarone, procainamide and cetalol. Amiodarone dose 150 mg over 10 minutes followed by maintenance infusion. Till now we were talking about stable tachycardia. So now we'll talk about unstable tachycardia with pulse. Here patient has tachycardia with hypotension and signs of shock. In this case we have to consider synchronous cardioversion. So what is synchronous cardioversion? Here we use a sensor to deliver a shock that is synchronized with the height of R waves. How to do this procedure? Get consent, give sedation, turn on the defibrillator, attach the monitor leads, press the sync button, select the appropriate energy level and give synchronous cardioversion. So how to select energy level? Again here, look whether it's a narrow or wide. If narrow, see whether it's regular or irregular. For regular like SVT, give 50 to 100 joules. For irregular like in AF, give 120 to 200 joules. For broad regular like in VT, give 100 joules. For broad irregular, give defibrillation dose. Note that is not synchronized. Here the shock may fall randomly anywhere within the cardiac cycle. That's all for today. Bye.